Samaritan's Purse is an international global Christian disaster relief organization. We've been operating for a bit longer than 50 years. We work in over 100 countries around the world, and we provide physical, spiritual, emotional help to hurting people, always helping in Jesus' name, and also always looking to try and partner to help the local church in the places that we work, to provide resource and to help equip them so that the aid is seen as coming from local Christians. And this is our mission. We've been doing this, as I said, for more than 50 years. Certainly. Our international CEO is Franklin Graham. He's the son of the famous evangelist Dr. Billy Graham. Dr. Billy Graham has a relationship with the Korean church that goes back to around 1972 when the Billy Graham Evangelistic Association came to Korea and worked with the Korean church to sponsor an evangelistic rally down in what is now Yoido Park. And at that event, over 1 million people heard Dr. Graham preach on a single day. And it is still the largest evangelistic event that the Billy Graham Association ever sponsored, and perhaps the largest evangelistic event ever in the history of Korea. And from those early days relationships with the Korean church and the Graham family, the partnership and cooperation has grown. Franklin Graham became the chairman and CEO of Samaritan's Purse now 42 years ago, and he, following his family's traditional love and connection with the Korean people, has continued to look for ways to partner with his organization with the people to provide aid, support, help in any way possible to advance the gospel and continue to maintain that great relationship that the Graham family has with the Korean church. Part of the core ministry of Samaritan's Purse is medical missions and providing medical aid. And so shortly after we opened our office here in Seoul, I met Dr. Young-Hoon Kim. And since we have been here over a year and a half now, he and I have continued to meet and talk about the opportunities to help meet the needs created by the COVID pandemic. He's aware of the work that we've done in the United States to help build capacity into the medical system there. Samaritan's Purse has actually opened facilities and operated them in New York, North Carolina, California, Mississippi, in response to certain surges in need for medical care. And he and I have talked about the possibility that this could be useful someday in Korea, and in particular in Seoul. In many developed countries, the idea of having the ability to meet a sudden surge in need for health care is not built into the local healthcare system. We saw this in the United States, we've seen it in Italy and other places where we've worked, and this has been part of the discussion that I've had with Dr. Kim. And when he saw how we assisted in the US, he felt like there was an opportunity here for Samaritan's Purse to partner with Korea University and also the Korean government to work together to meet a need, but also to work on the foundation of a system that would be able to expand and meet future needs of this sort. You mentioned the need for volunteers, and that is a key need. It's actually a bit easier to expand the physical facility to accommodate patients, but when you have a larger facility to use, you still need then more nurses, medical professionals, doctors to be able to treat the increased patient load. And what we have found that we're able to do through connections with churches, other NGOs, and the healthcare community generally is to assess what specific human resources are needed with some of the models that we've developed, and then go out and be able to recruit, train, and deploy those volunteers. We anticipate that in order to successfully execute the increased capacity that we hope to be able to add here, we will need to partner with the local medical community. Also, we've had particular luck or particular success in recruiting Christian medical professionals from the local church, and we're already beginning some of those conversations, and we'll continue to need to talk to the church community and enlist Christians who are interested in serving in this way. So we're planning a seminar and training February 24th and 25th. Anyone who would be interested would be invited to participate in that event. We'll be getting more information about that out. And then after being properly trained, we can then assess needs, specific needs, and deploy the needed personnel as the facilities are built out.